My name is Aaron Schill. I'm the Director of Data and Mapping at the Mid-Ohio Regional Planning Commission. And on behalf of MORPC, I want to welcome our audience to the third installment of the Regional Housing Strategy Speaker Series. Today's conversation, titled "A Zip Code Shouldn't Determine Outcomes, but It Does," will explore the influence of a person's place of residence and even their place of birth has on factors ranging from their health, access to opportunity, and a variety of other outcomes. We have a fantastic panel of experts today who will explore how we got here and what needs to change to provide a fairer playing field for all. Before we get started, though, just one housekeeping item. We do have some time at the end of the session for our panelists to answer questions from the audience, and we would encourage all of our attendees to submit questions throughout the discussion, which you can do in one of two ways. So you can see on your screen, you can either enter questions directly in the comments section in YouTube, or you can submit questions through the Poll Everywhere link that's shown on the screen. And we'll be posting that link to the comment section in YouTube also, so you can access it throughout the session. So to set the context for today's discussion, I'd like to share just a little bit of what we saw over the course of developing the regional housing strategy. As our team analyzed over 100 housing variables from more than 50 different data sets at the census tract level, it was consistently clear that housing outcomes are incredibly tied to geographic location. One of the most important measures that we considered was housing cost burden, or households spending more than 30% of their income on their housing. We can see some pretty distinct areas in Central Ohio of concentrated housing cost burden. So the first I'll draw your attention to is this kind of misshapen inverted T in Columbus. The east side of that T is I-71 going north and south. And then it kind of follows East and West Broad Street and extends down to I-270 on the southern end. We also see some areas of concentration in some of our legacy cities and the core areas, the downtown areas of some of our county seats surrounding Franklin County. I'm going to invite you over the next couple of slides to keep an eye on these areas. And I think you'll see some consistent trends emerge. So when we were looking at our home loan denial rates, we see very similar shapes in where there are concentrations of higher home loan denial rates. And we see some very, very strong trends with eviction rates. And so we may be tempted to think that this data is saying more about the people living in certain areas of our communities than about the impacts place has on housing outcomes. But we only need to refer back to the 1936 redlining map of Columbus and resources like the 2019 documentary Segregated by Design to remind ourselves of the lasting influence that structural factors like policy and investment decisions have on people's access to opportunity or lack thereof in some neighborhoods versus others. Just for orientation, this is in 1936, and it's right about here that a couple decades later, I-71 would be built. And this is East and West Broad Street, as you can see. So we're seeing very, very similar trends dating back almost 100 years. But the extent of place-based disparities becomes even more striking when we look beyond housing data. And we see that these differences exist across all aspects of people's lives. In fact, it's so consistent across measures that it almost doesn't matter if I remove the titles from these maps. So we flip through, we see the same shape time and again. Except, of course, it does matter because these are real indicators describing disparate outcomes for people's lives based on where they live. So these data are valuable descriptors of differences and conditions from one place to another in our community. But why this really matters is that one's place of birth is also a very strong predictor of future outcomes and life trajectory. In fact, a child born in the highest opportunity neighborhood in our community will make about 5 times more in income at age 35 than those born in the lowest opportunity areas. And this all culminates in that same child born in the highest opportunity area expecting to live on average 27 years longer, almost 50% longer than a child born in the lowest opportunity neighborhoods in our community. So now it's my honor to welcome our facilitator and moderator for the day. and turn it over to him to share a little more insight in what leads to these factors. Michael Wilkos is the Senior Vice President of Community Impact at the United Way of Central Ohio, and his team develops effective strategies to improve our community and invest in programs to implement these strategies. If you know Michael, you know he's dedicated to supporting holistic community revitalization in and around Columbus, something he's done for years, including during his tenure as Director of Community Research at the Columbus Foundation, where he initiated, led, and managed more than $9 million in competitive grant making to support this work in his home neighborhood of Wineland Park in Columbus. Michael combines data and personal experience to tell the story of Columbus, something that I've benefited from and learned so much from him over the years. And we're glad he can join us today to share some of that story and facilitate today's conversation. So I will turn it over to you, Michael.
Great. Thank you, Aaron, and good morning. I will now take over the screen. And Aaron, you can tell me that the screen is up for the audience?
Yep, we can see it.
Right. So I want to take a personal story and that kind of neighborhood-based lens and, the maps that Aaron showed quickly, I will use some of those again for Franklin County because we really can't see this information enough. This is the neighborhood in which I grew up. Mom and dad lived in this home for 46 years. When I finished high school, I was reflecting upon my academic trajectory, and I was reflecting upon the neighborhood in which I grew up in suburban Youngstown. I grew up in a neighborhood with 350 houses. All 350 were homeowners, and all 350 were white. And I just assumed that neighborhoods were this way because that's just the natural progression of neighborhoods. I moved to Columbus, and I get a job leasing apartments. 20 hours a week, Monday through Friday. I'm the only person on the weekend as the leasing agent, and I'm at the intersection of Westerville Road and Morse Road in Northeast Columbus. The apartment complex was about 60% white, 40% black. As a young first-time ever leasing agent, I'm told to do several things. One of those things, this was 1988, one of those things I was told is to, when prospective residents come onto the property and I'm assigning vacant units to those applicants, to not put people of color in units near the rental office. So when future prospective residents come onto the property, they think it is more white than what it is. I'm also told that if I'm there on the weekend and I accept an application, that I am to put a tick mark on the application if the applicant is a person of color. This felt wrong. I didn't know it was illegal. I called downtown to the HUD office and said, this is what I'm being told to do. And they asked what I would keep a log of everything I was told to do. And I did that. That experience as a part-time employee changed my career trajectory and a commitment to racial and social justice. Reading the book White Fragility and many other books over the past year, I learned a lot from the book with Robin DiAngelo, where she talked about how did we get the message that white people were better? How did we talk about white neighborhoods? The neighborhood I grew up in was good, safe, clean, and desirable. And by definition, the things I heard as a kid about neighborhoods in Youngstown was very different, neighborhoods to be avoided. Robin DiAngelo goes on to say she can predict whether or not a neighborhood is increasing in its homogeneity or becoming more diverse based on whether or not that home value is going up faster or slower than a community's average. I now live in Wineland Park, as Aaron said. It is a diverse neighborhood, and here's where I live. I live in a 2-bedroom, 1-bath, half duplex. The other side is a rental. I've been here 13 years. I am a gentrifier if you define me by my income and housing tenure and level of educational status. It's not how I behave in my heart. It's not how I operate, but there are unintended consequences of me living in a mixed income, mixed race neighborhood. All of us, whether we live in a neighborhood like Wineland Park or we live in a homogeneous neighborhood, we have gotten here through a series of policies that we were not maybe always aware of. One of the things we learned in the Franklin County Poverty Blueprint is that family income is one of the strongest predictors to measure success in the classroom and then also later in life. Here is a map of Franklin County. If you look at the chart, the 5 highest census tracts for net wealth of young people starting out in their career, You already have people in Upper Arlington, south of Lane, 15 to 24, starting out with 573,000 in net worth. But in places like Franklinton, it's only 8,000. Income inequality starts at 70 to 1. 40 years later, income inequality in Franklin County is 250 times to 1, where we've seen significant increase over 40 years of earned income in places like Upper Arlington and Worthington and Bexley, but many core urban neighborhoods have barely budged, including my own neighborhood, where the net wealth of people in that last decade before retirement is just 26,000. So let's talk about opportunity. There's a great tool that Ohio State created long ago, and I use it all the time. It are these 17 indicators across 4 broad categories that measure opportunity. We can collect it and we can map it. And here is both urban Columbus on the right and the county on the left. The darker the color, the greater the level of opportunity. And OSU says where you're born and where you continue to live matters. Whether you will finish high school, develop diabetes, get a good job, comes down to where you're born and where you continue to live. But race also matters. The map on the left is the Asian population. The map on the right is the white population. Each dot is sized according to the size of that racial group. And what you can see in the map on the right is it's really only the hilltop is an area that has significant white population that struggles. And this is how majority of society is really unaware of these struggles. When we now compare the Hispanic population on the left and the African American population on the right, very different patterns emerge. The Hispanic population, which is much newer to Columbus, is in moderate opportunity places in Northland and heading out past the casino. But for 70% of people of color, they're living in the lowest opportunity neighborhoods. So let's zoom in to this neighborhood that is a transitional neighborhood between high and low opportunity. Wineland Park is 4,000 people. It's near the Ohio State University. It is mixed use. It is 70% poverty. Some of that is OSU students, but it's a 90% renter neighborhood. And it represents many, I should say, of the regional housing strategy tools. Here's a meeting during the height of the pandemic where 60 people came to a housing committee meeting to talk about new development projects. And these 2 high density, underparked, walkable projects were approved along a commercial spine. But the other part of the neighborhood is this: 57 Section 8 scattered housing buildings that represent many people who are the most vulnerable in our community. Many of these occupants pay nothing for rent because of their life circumstance. We have Habitat for Humanity right next to market rate housing that blends in architecturally. And we had these vacant lots where federal NSP dollars supported home ownership for families at 120% of area median income. There's also in this example, a tax credit home that rents for between 40 to 60% of area median income, immediately adjacent to a market rate home that sells for nearly $500,000. You can't tell the difference between the market rate home ownership and the tax credit rental. And you have this, a block from my home, a supportive housing project for people with chronic homelessness and addiction, immediately next to a market rate apartment building that is luxury 1 and 2 bedrooms. As the pedestrian experience, you cannot tell the difference between one building and the next. And the neighborhood now is experiencing market rate infill, including accessory dwelling units, but it also has a lot of distressed housing like this home, which received a philanthropically funded home repair grant, which dramatically transformed itself. Many people come into this neighborhood. They cannot tell what's market rate, what's affordable, what's subsidized, and what is an income qualified homeowner who might have received a repair grant. Pearl Penn, who received that repair grant, said she never thought after living in this neighborhood for 70 years, she could see a neighborhood return to the way she remembered it was. It is not the neighborhood she remembers. It's a different neighborhood because all of those 100 recommendations in the regional housing strategy have been focused in a place like Wineland Park for the past 15 years, which has created a successful market rate neighborhood that is economically and racially integrated. But it needs a tool like the regional housing strategy to make that happen. So what's the history behind all of this? And how did a neighborhood like Wineland Park follow this trajectory? There were 3 kinds of zoning in this country: racial, expulsionary, and exclusionary. Racial is just what it says. We'll talk about that. Expulsions, we just don't want factories next to people's homes. And exclusionary is exactly what it suggests, which is based on the income of those who live in the neighborhood. Zoning did come to this country from Germany, and it was really focused on building size and density and separation of land uses. American cities were dirty and they had lots of negative issues. But the first example of racialized zoning was in Baltimore in 1910. It did not last long because by 1917, the courts struck it down. However, despite the fact that courts struck down racialized zoning, it did move into the private sector with restrictive covenants. Here's an example of the first racialized zoning plan. This was the City of Baltimore's approved plan. You can read this quote at the top, but what I want to point out is the use of the word quarantine. They wanted to quarantine people of color so people of color would not be giving communicable diseases to nearby white neighborhoods. This was policy, but the courts did what they should do, which is strike this kind of plan down. However, it was the restrictive covenants that really perpetuated that kind of belief system. And in a place like Columbus, like every other community, both in the city and in our suburbs, restrictive covenants, about 70% of all subdivisions had restrictive covenants. And you can see the common exclusions on the right side of this slide. I have given this presentation in places like Upper Arlington, where people have come up to me and said, I have the deed to my house, and it says I may not sell my home to an African-American until 1999. That was still in their deed. Obviously illegal and not enforceable, but it still exists. So the Homeowners Loan Corporation Assessors, HOLC, they would be hired by insurance companies and banks to go out and do assessments. The first would be to look at the physical conditions. Is there deteriorated housing? Are there noxious industries nearby? Is there, a combined sewage overflow? Are people safe from those industries? You can read the yellow box at the bottom around the social conditions, right? And that was anybody of Negro blood. There were other folks in addition to African American and Black that would be excluded. And whether there was a nearby factory or there were people who were non-white, the use of the word hazardous was often used. Here's a picture from one of those HOLC assessors that talked about the colored business section along East Long Street, which is now in the King Lincoln District, a very vibrant neighborhood. But because it was deemed hazardous 85 years ago, it set a trajectory of that neighborhood to not be a prosperous place. Here is the south side of Columbus in the area that we refer to as Steelton because of Buckeye Yards, showing foreigners. It was also deemed hazardous because of the foreigners who lived there. Here are a couple quotes actually taken from an HOLC assessor's card, where if you just had 4 Negro families on one street, or 5% of the neighborhood was a Negro, that neighborhood was deemed hazardous and therefore unworthy of investment. This is the map that Aaron showed. I'm sharing it again. Those areas in pink were hazardous. Milo Grogan, portions of the Short North, the Near East Side north of Broad and Franklinton, the areas in yellow were those that were declining. They were declining because of demographic changes. The impacts of the redlining tool still are here today. You can do a Google satellite and look at my neighborhood versus Victorian Village. It's very hard to see rooftops and pavement of streets in a place like Bexley, Upper Arlington, and even Victorian Village, where in a place like Wineland Park, there is a much lower tree canopy. But all of the other things you see here are the impacts of redlining 85 years later. In addition, there have been surveys that have looked at many of these places: Grandview, Clintonville, South Bexley, Driving Park, Westgate. They're the exact same houses and oftentimes built by the same architects and developers, but a neighborhood that would be in the pink or yellow versus a neighborhood in green, those neighborhoods in green have seen $200,000 more in appreciation than the exact same house in a neighborhood that would have been surveyed as hazardous. The impacts and benefits of redlining are still being felt today. So now we compare that redlining map on the left from 1936 to the foreclosure map of 2006. Where did the foreclosure crisis start? It started in Black, blue-collar neighborhoods near the core of the city, neighborhoods that were redlined in the 1930s. Ohio State University in 2010 looked at all of the places that had private sector predatory loans issued. You could find the railroad track along Interstate 71 running north of the city. You can see the curve of the river in Franklinton. You can find Parsons Avenue on the Near East Side. So we can map all kinds of these things that Aaron says are the reverse T. Here's infant mortality rates. Areas outlined in black have infant mortality rates that look like developing nations. Here's that opportunity map. The brighter the red, the greater the opportunity. All of the dots show where either the shooter or the victim was a teen in our community. Is there a connection between gun violence and the economic prosperity of their parents? You bet. And here's Legal Aid Society heat map. Much of this is showing the eviction process, where women and people of color are going through the eviction courts at 3 times the rate they should based on the percentage of the population they represent. Here's an incarceration map of where people lived before going into jail. You can find the railroad track along 71. You can find Parsons Avenue. And here is food pantry use mapped by Mid-Ohio Food Collective. It's that same inverted T. And it summarizes in this. Here we zoom into Franklin County. For 30 years, I have been living in a neighborhood that's red, which means up to a 27-year suppression of life expectancy versus areas of blue. The reality is I spent the first 21 years of my life growing up in a neighborhood that's blue. So I got all the benefits of segregation. I received all the benefits of racism, if you will, by living in a homogeneous high-income community with good schools, which enabled me to get into the Ohio State University and move on that trajectory. As a practitioner in this space, I have chosen to live in neighborhoods very different than those that I have grown up in. I understand there are unintended consequences of me living there. I do not believe my life expectancy will be suppressed because of where I live now, because of the foundations I had that set me off on a good trajectory. In the book, Color of Law, that Aaron mentioned earlier, and I encourage all of you to watch the 18-minute animated documentary of this book, where he says, we have created a caste system in this country where African Americans have been kept exploited, and the geography separate by racially explicit government policies. Although these policies are now off the books, they've never been remediated, and the effects endure, and many of us are profiting, and many of us are being held back by these policies today. So with that, we're now going to turn it over to our expert panel, and we have a series of folks who will do self-introductions. We will go with Netta, then Brandy, then Niall, and then Joshua, and go through a series of questions. Thanks so much.
Thank you, Michael. Hi, I am Netta Whitman. I am the Director of Housing Advisory Services with Homeport. Homeport is a nonprofit housing developer. We develop affordable housing communities, both for sale and rentals in the Central Ohio area. Homeport provides financial literacy, education, counseling, and coaching, as well as first-time homebuyer education and counseling. Homeport administers a down payment assistance program for Franklin County residents to assist with paying the down payment and closing costs associated with first-time home ownership of up to $15,000 for qualified applicants. Thank you.
All right. Good morning, everyone. Thank you all for joining today. My name is Brandy Avery. I serve as the co-CEO and a co-founder of Keys to Black Wealth. I'm also a licensed financial service professional, licensed financial educator, and I've been in this industry for about 15 years now. Keys to Black Wealth, we are a multimedia and edutainment firm. What that means is we combine education and entertainment together to be able to deliver our services. We deliver services such as financial literacy and wealth building housing services, tangible resources that's designed to be able to help people transfer generational wealth. So with Keys to Black Wealth, our whole entire mission is about solving the racial wealth gap. And we believe how you do that is through education. We have some signature events that we throw. We have a local presence here in the Columbus, Ohio area where we were born and birthed. However, we do operate nationally and internationally as well. And I'm looking forward to talking to everyone today.
Good morning, everyone. I'm Niele Juris. I'm the Director of Communications and Engagement with the Mid-Ohio Regional Planning Commission. And I think you all know what we do, but I'll go into it. We're a regional council for local governments. And so we have more than 70 members across 15 county region. Our members are comprised of villages, townships, regional organizations, counties, and cities. And we take pride in bringing these communities together to collaborate on best practices to plan for the future growth and sustainability of our region. And so our some of our primary areas include transportation, sustainability, data and mapping, government affairs, and in everything we do, we always want to ensure that diversity, equity, and inclusion are at our core. And so some of the initiatives that we have led are the Regional Housing Strategy, which is part of why we're here today. Our broadband, we're part of the Broadband Coalition. So there are many things that MORPC touches that a lot of people don't know. And so I'm really excited to be among a distinguished guest of panelists. Thank you.
Well, good afternoon, everyone. My name is Joshua Joseph. I'm a physician scientist here at The Ohio State University Wexner Medical Center. A little bit about me. I was born here in Columbus on the Near East Side at the corner of Bryden and Kelton Avenue. St. Anne's Hospital, which is no longer there anymore, moved to Westerville at this point. I grew up on that Near East Side in a yellow kind of declining area, and a part of the other area was a red hazardous area. My family ran a small business focused on disabled, elderly, and low-income housing through HUD 202 and 811 projects. And I was fortunate to be able to go to Columbus City Schools and really in many of the areas that Michael and Aaron were talking about, including the Linden area. So after high school, I spent a long time on the East Coast, up and down the East Coast and 95 from Boston to DC. And in those experiences, really spent a lot of time in underinvested communities to understand how disease and underinvestment in community go together. Returned to Columbus 5 years ago, and our research group really focuses on stress hormones like cortisol. And then how do diabetes and cardiovascular disease health equity? How does that relate to communities? How do we understand some of those risk factors for disease and solutions to address these risk factors? And now we're really getting into the linkage between stress and disease in communities. And our long-term goal is to really co-develop solutions. And so with that, I pass it back to the moderators. And you're on mute, Michael.
Thank you, Dr. Joseph. You'd think after a year and a half, we'd all get the mute button figured out. As you can all see in the audience, we have a great panel of experts to talk about these issues. Please follow the instructions that Aaron had laid out earlier if you have some questions that we can take from the audience as we continue to go through this conversation. As all of you on the panel saw, that both Aaron and I looked at both neighborhood and regional issues around opportunity. I want to start with you, Netta. We are a very rapidly growing region. I keep hearing the 3 L's, land, labor, and lumber, which are really making development costs high in our region. How does Homeport decide what neighborhoods to build in, and how do you go about that process of identifying those communities, and what makes them right for a Homeport intervention?
Okay. As a mission-driven organization, we have a few goals when we develop or consider a new location for a community to build housing. Number one, it's where our residents want to live and where they can have access to amenities and assets such as jobs, schools, transportation, recreation services, and healthcare. Number two, another is to partner with communities and neighborhoods to meet their housing needs and serve the community through eliminating vacancy and blight, or providing infill development options. Much of our work has been grounded in revitalization of disinvested areas and providing high quality, affordable housing to communities as a catalyst to further public and private investment, like on the Near East Side, Milo Grogan, and the London area. Give me one second. Often we get invited to partner by residents, stakeholders, and civic leaders and work collaboratively to develop projects that are additive and the goal of strong communities.
Right. And for those folks in the audience that may not know Homeport, approximately how many communities or units do you own or manage in the Central Ohio region?
We have approximately 2,700 units in, I think, 35 different communities around Central Ohio.
Okay, thank you. I want to turn to you now, Brandy. As a financial education specialist, what patterns do you see with economic stability? Maybe even, prior to COVID or since COVID. These are complicated times. What's going on in your world?
Yeah, so definitely thanks for the question. There is a few patterns that we're seeing as far as economic stability. First of all, when we look at just the African American community and the Black community as a whole, Blacks has the least tangible amount of wealth here in the United States. And that's the biggest thing that we see. We think about different things such as the racial wealth gap, and we're going to get into some of this a little bit later. But we see that median wealth continuing to widen, not even amongst just Blacks, but the middle class. So that gap between the middle class and the 1%ers or the upper class is continuing to widen. So there's a lot of issues that we're seeing in that space. Now, one thing with Keys to Black Wealth, one of the reasons why we're really focused here on the Ohio area, when we look at the lowest part of wealth, the lowest tangible wealth, Columbus, Cincinnati, and Columbus, Cleveland, and Dayton, rather, has the lowest tangible wealth right here and throughout Ohio. So it's really important that we put a lot of emphasis on this area and these communities because people are just struggling. They're struggling to get ahead, and then they're also struggling with different things such as credit score. We're going to talk about that, as well as housing and the housing gap as well. In fact, when we look at housing and home ownership, we know that that's one of the quickest ways to wealth for most individuals in our country. But when you look at Black people, there's been virtually no change in home ownership in the last 50 years. So I know we're going to talk about that a little bit later, but some of those things that factors into that is things such as credit and credit scores, people ability to access loans and lending, people ability to be able to access just education, and not only any education, tangible and practical education, financial education that they can apply to their current financial situation. And then there's different things such as our income gaps as well that we're seeing across the board. Right now we have seen a major transition as it relates to COVID, as it relates to the gig economy and the way that people are actually working. And while those things are great, there is still a huge disparity amongst income. Part-time work, people are doing things such as working for Ubers and Lyfts and, shopping at Kroger for people. But that pay and the amount of hours that you have to work to be able to produce a quality pay for yourself is just, is absorbent. So those are some of the issues that we're seeing. And I know we're going to talk specifically about some of the credit trends as well as some of the housing trends as we get deeper into the conversation.
Great. Thank you for that. As I look to you, Niall, and it's so great to be on a panel with you, Niall, because we worked together 15 years ago, and it's great to see that, we're both still doing it, believing in our community, but you're a communications expert. And one of the things I have found is that, many of us who are from other parts of Ohio, we see the growth of Central Ohio, right? Both in urban neighborhoods and the rest of the city. And we see it in the suburban counties. And everybody just sees this growth and they think everybody is doing great. You know that that's not true. And you excel at sharing stories of people and communities. And you also have personal stories about both navigating the housing market generally, and then specifically, you live in a neighborhood that's a lot like where I live, which is in the King Lincoln Bronzeville neighborhood as a resident. So, talk to us a little bit about your firsthand experiences and what it's like to be a communications person to explain it. There's a lot of people who struggle despite what appears to be a lot of obvious progress at the same time.
Sure. One of the things that I'm proud that we did, I don't know if many of you attended our annual State of the Region, and one of the components or one of the things we added this year was kind of like a story time. And so we highlighted we highlighted the King Lincoln community. We talked about the Big Walnut Country Club in Gahanna, and we talked about, what's being done in Appalachia, Ohio. And one of the things that we had gotten a lot of feedback is that people didn't really know the history. I know, Michael, we talk about it all the time, but people really just didn't know the history of these neighborhoods and how they were once thriving communities, Black businesses, Black homes. But as we know, with the freeway or the expressways coming in and dividing those communities, many of the residents were displaced. And so years ago, I made a commitment to move into King Lincoln, that area. And so at the time, I wasn't able to purchase a home. But what drew me was the story of that community. So as someone who has to tell compelling stories in order to get our message across, they had a compelling story, and it made me want to invest into that community. And so one of the things that we've tried to do, especially with the regional housing strategy at MORPC, is to make sure that people understand the history, they understand why certain communities are not afforded the opportunity for home ownership, why it's been difficult for certain people to get loans and others can get them easily. And so that is a critical part of what I do, is to make sure that our message is aligned, people understand the history, understand the current conditions, and understand what the next steps are. Now, from a firsthand perspective, again, I live in the community. I'm not a homeowner, but it's not for lack of trying. Over the last, I would say 2 to 3 years, I have been so diligent about trying to purchase a home. And when I first started this, I remember I was at a workshop and I went up to a gentleman and I said, as someone who is I would consider myself maybe upper middle class, someone who can afford to buy a house, someone who has, good credit, these things, I'm finding it very difficult for me to get a house. And his first thing was like, you should move out that neighborhood, move to Franklinton. And I was kind of taken aback, and I said, why can't I stay in my community? I've invested a lot of time in here. I love the history of it. But what seems to be happening is that even though I make really good money and, for just, doing what I do, there's no units that are available to me, or they're high priced. I had put something on social media, my personal, and I was talking about how this one house originally priced may have been $50,000. It went up to $200,000. It sold for $725,000. As a public servant, I really can't afford that kind of housing. And so like I said, I know firsthand the experiences that many people are going through. And I know a lot of times when we talk about housing affordability, we're looking at it kind of more from lower incomes. But what's happening is the middle class is being impacted. We're getting squeezed out of the housing market. And some of us, we can't afford this, but if we want to travel, we want to live a balanced life, we want to buy nice things, we won't be able to do all of that in the current state that it's in. And one other thing that we're starting to see is corporations coming in and purchasing these homes and hiking up the prices. Me and my friends, we sit around, we talk about this all the time. So I've taken a little bit of a pause, because it is almost like a full-time job, even if you have the best realtor, to try to get a home right now in my community. So just taking a pause, because everything is escalated right now in terms of people are giving over the asking price, and I can't compete with that. I don't have $100,000 sitting around. I just don't, not yet. But those are just some of the experiences. It makes me be more empathetic to the people that we're trying to get the information out about what we're doing to create equitable strategies for our housing strategy. I tell them, like, look, I can relate. I can't even buy a house right now because there's nothing available for me at this time, but hopefully in the next year or two, those things could change. So thank you for allowing me to share part of my personal story. Now, I don't really tell out personal things, but it is something that is commonly discussed in my professional networks. And as a single person, it is a little bit challenging to purchase a home right now. So
thank you for sharing your story. I mean, I think a lot of people see the amount of construction around the city, but I don't think people understand how much Columbus is growing, and that pressure has really been building. So I'll turn to you, Dr. Joseph. Right, your research really examines risk factors for the development of obesity and type 2 diabetes in diverse populations. What are some of the primary risk factors in that work? And is there a relationship between a person's environment and then the chronic health conditions like diabetes that people are experiencing?
Thank you so much for that question, Michael. And when we think about these chronic risk factors that individuals may have for diabetes, there are some of them that are modifiable risk factors and some of them that are non-modifiable risk factors, meaning some of them you can do something about and some of them you can't. So when we think about that, age is one of the biggest non-modifiable risk factors. 1 in 4 individuals over the age of 65 has type 2 diabetes. But among some of those modifiable ones, I'm wearing my Life Simple 7 pin today that you probably can see on the lapel there. And there are 7 factors that we know are really critical in diabetes prevention. They include blood pressure, blood glucose or sugar, cholesterol, body weight, right? We call it BMI, but it's really body weight, right? Physical activity, diet, and nutrition. And I usually add to those 2 others, and that is stress and sleep. And for all of those, there are, different numbers that we think about. Like for physical activity, getting 150 minutes a week of physical activity. And I'm out at health fairs and people say, well, Dr. Joseph, when I'm doing that physical activity, how intense is it? And I remember being at a health fair and I said, well, it's enough to make you sweat. And the lady said, well, I don't sweat. I said, okay, well, it's enough to make you perspire then. She said, well, Dr. Joseph, I don't perspire. I said, well, no, I heard that one at a health fair last week that I got to go with perspire. And she said, no, I glisten. I said, well, enough to make you glisten then. Right. And so 150 minutes a week of physical activity, eating a healthy diet with fruits and vegetables in it and fiber is so important. Not smoking is a huge key. And then, like I was saying on those other ones, increased stress levels. Our research group does a lot of work on a hormone called cortisol that is driven up when you're under stress. So, Michael, I don't know about you, but if I saw a bear in the woods, right, my first reaction would be to run. My stress hormones would go up. Now, Michael, you might be different. You might know to get on the ground and curl in a ball and all those things, right? But my reaction would be to run, even though that bear is going to run you down pretty quickly. And so when that happens, your body produces these stress hormones. But unfortunately, in our current society, many of us see a bear every day, right? And it's not that typical bear in the woods, but it may be that environment that you live in and how that environment impacts you. Maybe it's 2 to 3 jobs. Maybe it's 4 to 5 bus transfers to get to work. But all of those create chronic stresses, and those chronic stresses drive up cortisol, and that drives up risk for diabetes as well. And so those are some of the ways that diabetes interacts with that. The last thing I'll say is that when we think about the environments in which we live, it may be very difficult for someone to be physically active. If the sidewalks are crumbling, and I know Morpsey wouldn't have crumbling sidewalks, and I know we're working on a lot of great plans so that everyone has great sidewalks. But if your sidewalks are crumbling, or you don't have a track nearby, or there's a lot of violence. We're talking about violence a lot in Columbus right now. So maybe you don't want to be outside because of the violence in your neighborhood, right? Those are all things that detract from the ability to do that physical activity. In other areas, like the area that I grew up in, there are food deserts. We had one grocery store over on Holtzman in Maine. That was it. I didn't even know there were other grocery stores besides Kroger growing up. I thought that, Kroger was every grocery store. But then we also live in areas that are food swamps, right? And what do I mean by food swamps? They have, fried foods and fast foods on many corners. And so when we think about these things, they all drive risk for diabetes. So it's not only the risk factors, it's the environments in which we live and how those environments end up producing those risk factors.
Yeah, thank you for that. I've not heard that term before, the food swamps. That's a good one. Brandy, let me turn to you. Let's talk more about the relationship between where someone lives and their accumulated wealth or their ability to build wealth. we showed the maps, right, where wealth begets wealth in places like Arlington or Worthington and Bexley. What are maybe some of the strategies that can be deployed to help people build wealth in communities that maybe don't support that organically?
Yeah, I think that's a great question. And I kind of want to go back to a little bit that what Nielle was talking about being a middle class, upper middle class, and still not having enough to be able to compete in this current housing market and just in the market in general. And I think oftentimes, when we look at some of the social service programs that exist, when we look at some of the resources that's available to our communities, I think oftentimes we forget about the working middle class. I think that's one of the key factors why, people like Nielle and even myself have been in positions where we make a great income. We are hard workers. We're participating 100% in society, but oftentimes people like her and myself and many people like us, we're carrying the weight of, our economy on our back. You hear it all the time about middle class workers and the upper middle class and the central middle class carrying the weight, a lot of the economic pressures on our back, but there's often not many resources readily available to us. And I think that's just something that our entire system, our community, we need to look at. Because when you have individuals who's carrying all of these different things, the brunt of the tax burdens, things like that, being people who single without having any children, there is no tax credits, there is no additional things coming or additional assistance. Most of our assistant programs, and which obviously it makes sense, is going to be for our LTMI groups and those individuals, which is fine. But when we think about the middle class and how much pressure we have and how much weight we're carrying as it relates to our economy and our communities, these are typically the people who's giving first on a GoFundMe. These are the people who's typically giving first when it's time for the donations. And so I think we really just need to look at overall, how are we structuring some of these programs? Do we want to continue to separate the middle class and widen that gap? Or do we see the importance of having the middle class being supported so that we can continue to carry the weight and the pressure that we currently hold in our communities? I think that's something that we really have to look at, and I don't have all the answers for that. It's been on my mind for several years as it relates to this particular group of people. And I think that we're often the invisible population in our communities because, it looks good on the outside. It feels good on the inside. We're carrying a great energy throughout our communities. But oftentimes, we are suffering. We are struggling. Sometimes we have to, think about if we want to shop or eat healthy, just like other individuals as well. So I think that's a group of individuals that we really, really need to hone in on as a community and start coming up with some type of solutions to be able to say, okay, what do we really have here? And what is this person? What is the outputs of this particular group of people? And that may be a great place to start to look and see what is the average output that a middle class earner is actually shelling out as it relates to taxes and different type of community things that we have to participate in to keep our community whole. That's a major key area. I know with Keys to Black Wealth, that is our focus. We do focus, our target market is not the low to moderate income. It is the middle class American, the working Americans, because we do understand that there is a level there's a gap, and in order for us to fulfill that gap as it relates to the wealth gap, there's going to have to be some support and strategic support and resources geared towards these group of individuals. So we're looking at different things like, first of all, making sure that we're aware of the financial resources that's readily available to us, right? Making sure that we can access those products and services. Then there's we focus on different things like income and investments and insurances. That's a huge area of opportunity. Oftentimes in my world, because I am a licensed advisor, we talk to a lot of people about how do we create and generate wealth. Well, one way that we can immediately create generational wealth is by having life insurance in place. And that's just not middle class Americans, that's everyone, right? Because here's one thing that we know for certain is that one day we're all going to check out, right? I'm just the messenger, but we are going to check out one day. And when that day comes, there's an opportunity for us to make sure that next group coming up is taken care of. So we need to do future financial planning, right? Not just thinking about today, but also thinking about the future. And then that's a personal responsibility. I personally feel that we should all hold ourselves accountable to be thinking about forward progress for our future, because we've studied poverty. We've studied all of this stuff. We know redlining exists. We have all of the data. We have it all. So when are we going to take this conversation and all of this data we have and move it forward? We constantly have these panels and we constantly have these conversations. And we talk about the housing. Okay, we know for the last 50 years, Black people, the numbers are the same. We know that the racial wealth gap is continuing to widen. We know poverty is a crisis. We know homelessness amongst African-American women in Franklin County is at an all-time high and the highest amongst any other group of individuals. We know all of that. So, and we're constantly putting money and resources into studies and research in those areas. But when are we going to reallocate the research? When are we going to reallocate the money? When are we going to reallocate the energy to be able to actually have some forward progress? And there are some very tangible things that we can do. It's really a mindset shift. And I think that until our entire community gets on board, and in particular, the leaders and the people who's cutting the checks, the people who's looking for the outcomes, we're going to constantly keep having these type of conversations over and over again. And, it'll be 30 years down the line, me and Neil will still be, having these conversations because it's a repetitive conversation. It's a repetitive dialogue. So it's time to move.
We've got a question from the audience, and this might be best for you, Brandy, because you're kind of heading in this direction, but it's for any one of you. Question is, what advice would you give to banks, and how can they help to move the needle on our current housing situation? I'm going to share another audience question that all of you can be thinking about also as you maybe organize your thoughts on that one. And that is, the question is here, we have that housing and health inequality were legislated and then enforced via redlining. So it stands to reason that solutions to these issues must also be legislated. So what legislative efforts might be in the works, or might you advise, whether it's around social determinants of health for you, Dr. Joseph, or maybe some public policy, maybe for you, Niel. So just be thinking about what are some of the legislative efforts that could begin to change this. But let's go back to the other audience question around what advice would you give to banks if they could change something with what they do to change these outcomes, so we're not just having conversations.
Yeah, I can jump in on the bank question and share just some few thoughts. And I want to just kind of bring it to just the area that I focus on primarily most, which is the credit scores and how we're looking at credit scores to be able to give access, lending access and resources to our consumers and our community members. First of all, I want to make sure that everybody's informed and aware of a new credit score model that just dropped called FICO 10T. It just dropped in 2020 and it's now rolled out, and it's going to affect millions of Americans coming this July, this month right here. You'll start to see the impact of FICO 10T, and it relates to banks and the lending aspect. What this particular credit score is doing is looking at all the other variants that previous credit scores looked at, such as how much money do you owe, how much capacity are you, your new credit, things like that. But one particular thing that it's going to be looking at that's new is a 24-month trend. It's going to go back and look at 24-month trending data to see how have you managed your current loans over the past 24 months. And they're actually looking at how much have you actually paid against your current credit cards and your current loans. They're also looking at people who's transactors or revolvers. So transactors are people who actually pay their debt off in full every month. People who have revolving balances are those individuals who's keeping a revolving balance. And most individuals in our community are keeping a revolving balance, right? Which means that you're not paying off your credit card every month because that's the whole ability to be able to leverage credit, right? Well, what happens in these particular situations, because we have this new FICO scoring model, is if you have not been able to pay that balance off in its entirety over the last 24 months, you're going to be dinged. So those individuals are going to be penalized, and you're going to see a lower credit score. Now, when you get to the bank and you go out for your lending, your auto, your mortgage, or whatever it is, business loans, they're going to look at these type of things. Well, what just happened over COVID? What just happened over COVID? So you have these particular credit scoring models that dropped literally during COVID. Well, what did everybody do? Slow pays. Everybody took advantage of those slow pays. A lot of people put their mortgages on deferral. Student loans is deferred until, September. Still, autos. We had the eviction moratorium. So you have all of those different things that people took advantage of. But now here we are, we have a new FICO scoring model that actually is exactly against that. It goes exactly against that. So now when people go into the banks and the credit unions and you're looking at different things such as slow pays and taking advantage of some of those CARES Act benefits, you're going to be penalized and dinged for that. So I think that should be automatically eliminated. I think that it was a bad idea to drop a FICO 10T scoring model looking at 24 months of history during this time. We're in the middle of an economic crisis. So I think things like that just needs to be eliminated. And that's where policy and law, just to go into that second question, that's where policy and law takes place. That's one of the 7 keys to Black wealth, which is policy and law. And you have different things like that that's happening and penalizing our consumers during an economic crisis. It is exactly designed to do what it's going to do, and that's to keep people pinned down. So, and yes, I have an attitude about it.
Yeah, that's a lot. Thank you for that, Brandy. What are some other legislative things that maybe you're paying attention to across the country for any of you across the panel, or if you could wave a magic wand and change some kind of policy or legislation to improve outcomes in your world, what would that look like for any of you?
Well, I know Dr. Joseph is going to hit on this, but I know an important step was declaring racism as a public health crisis. And so I won't touch on the social determinants. I'll leave that to Dr. Joseph. But I thought it was a very important step. A lot of our members were among those first communities to do that. And in doing so, it was more or less in taking that action to say, this is real, this is something we really need to study, and we need to take action. So it's not enough to make those declarations. What needs to happen next is what action is going to be taken. I know last year, MORPC, we added social and racial justice part of our public policy agenda so that we can address it to help eliminate barriers, access to transportation, housing, broadband, but for us to keep an eye on legislation, for us to advocate for that equity in our region. And so I think, a lot of people didn't understand why people were declaring it as declaring racism as a public health crisis, but racism is threaded through every aspect of our life. It doesn't just impact Black people, it also impacts Brown people, it impacts all communities. And so if you don't acknowledge it and you don't look at the health or social determinants of health, you don't understand the correlation about the impact of stable housing, how when you don't have it, your child is not afforded academic success, how it contributes to different health issues, how it impacts quality of life, air quality, health, things of that nature, asthma. So all of these are interrelated. And so in undertaking the regional housing strategy, our commitment was to track those inequities. Our commitment was to empower communities with a toolkit to help them make changes to zoning and that sort of thing. So I think that we've been trying to lead the charge. We've been trying to take these steps in order to make sure that everyone in our community has access to these things that help us live a great quality of life. So I know Dr. Joseph, he's ready to jump in and talk about social determinants. So I'm going to punt it over to you.
Well, I appreciate that, Nael, and you're 100% correct. And you actually went through it really nicely. So there's not a lot that I need to say there. But what I will say is that we have to have equity in all policies, right? We have to start policies from a point of equity, not develop a policy, get to the end of developing the policy, and then send it out to some folks who think about equity. And I think that that's the transformation that we really need on this. The second point about it is that there's not one policy that's going to change this, right? We talked about the FHA and redlining and those things earlier. Yes, there's gaps there. There are things that need to change with affordable housing. Yes. There's things that need to change with early childhood education. Yes. If we're being honest, a living wage is no longer $15 an hour. I saw analysis in the dispatch where you can't even, if you work full time, you can't even afford a 2-bedroom apartment on $15 an hour in the majority of the United States. They couldn't find a state where you could afford that. And so there's not one single policy It's that we have to work having equity in every policy to change this and to move this forward. And that relates back to what Niall was saying about structural and institutional racism over time. The way to deal with this is to really focus on equity in all things that we do.
So I want to move it into kind of a personal level and go to you, Netta, because, you've got 35 communities, you've 2,700 families, how does Homeport, you manage communities. So some of that is maintenance requests and lease enforcement, but you do more than that because you care about the families that live there. So tell us a little bit about how you operate supportive services and do financial literacy training and other skills so families can, maybe no longer need to be in a Homeport community, but then are ready to go out and navigate the open market. How important is that in the stability of families that you serve? Because you serve families that are vulnerable. They're not the most vulnerable, but they need some kind of assistance, but you're more than just a landlord. Tell us about that.
We are more than just a landlord. Speaking to Homeport residents specifically, we do have our resident services department that provides supportive services for those that live in our Homeport communities. And when we say supportive services, if a resident specifically is having trouble paying their rent, especially right now due to, COVID circumstances. Homeport does have access to some funds as well as some partners that are assisting residents with being able to meet that need and get that rent paid so that they're not vulnerable to eviction. If they are in need of furniture, we work with partners for, say the furniture bank or food bank, or we have all sorts of resources around the city to be able to prop them up and help stabilize that family. We recognize that stabilizing the family is like the most important thing at this time because we're dealing with COVID, but we meet the clients where they are. So whatever it is that need is where we try to address it. We have developed programs, especially our financial literacy, our home readiness program, that's going to give them that baseline information that they need to either stay stable or if they're choosing to move into the route of homeownership to understand what that process is going to look like and have all of the information and understand what that commitment is. We will work with them for as long as they are in need of our services. There's not a specific timeline to do it, but we have also worked with our partners, especially for, let's say, home ownership and working with Franklin County commissioners to make sure that the programs that we offer are actually meeting the need. We were able to get them to increase the amount of down payment assistance that we had available because we recognize, the rising cost of housing in Central Ohio, and our residents or our current clients were not able to be competitive with the assistance that we were offering. So we were able to get that increase to $15,000 to be able to assist more with what those fees and costs would be to be able to stay competitive. We have worked at making sure our programs are efficient so that as the homeowner currently is selling the property, they're not turned off by the prospect of someone getting down payment assistance and therefore move on to the next property. We're able to make sure that we're able to provide that assistance in a timely manner so that it's not a hindrance to that home buying process. You're muted.
Thank you for that. We have a question from the audience, which is really hot right now. And the regional housing strategy did a great job of understanding the difference between gentrification and displacement, because we have displacement happening everywhere in the region. It's happening in rural parts of counties. It's in Lancaster and it's in Marysville and it's happening in Northland and it's happening, along Parsons Avenue. Gentrification is a different issue. I'm going to read the question, and this will be open to any of you on the panel. How do we work to both improve living conditions within communities that have had a history, as described in the earlier part of the presentation, of segregation and then blight, without then gentrifying the area? As an example, in neighborhoods like Victorian Village or German Village, how do we make sure that people continue who want to move into those areas and surrounding neighborhoods don't push out the families that have historically lived in those areas, especially as new properties or improvements to properties increase a neighborhood's value? This does become an issue of when we are successful at making neighborhoods safer, cleaner, nicer, right? People who have options of housing choice will choose these neighborhoods. What thoughts do you have? And I know for those of you in the audience who are interested in this topic, please go to the Regional Housing Strategy Report. You can see where MORPC has detailed where there is gentrification risk, where there is displacement risk. They are very different things, but they feel exactly the same for people who can no longer afford housing. All of you are really experts in this field. I just was thinking earlier about you, Dr. Joseph, about where you grew up and the neighborhood you lived and how you view those neighborhoods today, and where maybe you have chosen to live personally at this stage of your life. So we'll just open it up to really any of you on this really complicated topic. This could be a whole session in and of itself.
I know, and it's something I know I've heard you talk about many times, and I know a lot of times gentrification, when you hear it, you're like, oh God, this is the worst thing ever, but it's going to happen. I think the consequence of that is the displacement, where there's not a public-private partnership, where people are not working together to help those individuals who may not be able to afford the increased the property taxes, or giving renters an opportunity to buy. So I think investment, finding that balance is probably key to that. And I think if you're someone who lives in a neighborhood and have lived there for a lot of years, you do see the changing dynamics. I think where some of the issues come in is when you have certain people coming into the neighborhood trying to change the culture of the neighborhood. And I think there needs to be, and this is kind of maybe where that storytelling, that education comes in a little bit, there needs to be that balance with preservation. You need to understand that there are cultures in different neighborhoods. You may not like it, but you can't come into a new neighborhood trying to change things. That's where you start getting into it. I mean, I see arguments. I used to go to some of the meetings in the neighborhood before I moved in the neighborhood. I was doing grant reviews and things of that nature, and it was like an all-out fight between the people who had lived there for a long time and new people moving in, talking about, I don't like your flag. I don't like the way this looks. I don't like the color. I mean, there was just this bickering back and forth. And I think just having that respect, understanding the history of that neighborhood, understanding that culture needs to be preserved. But I think the key is really just finding innovative ways to protect people in the neighborhood who may be at risk of being displaced, whose homes are in despair, trying to come up with a public-private partnership to help them and then help the renters, people who aspire to buy a home, some rent to purchase opportunities. And that's just me talking in my circles, me, looking at different data. But I think as I think about gentrification, the displacement is that consequence if it's not done in a balanced way. And I know, Michael, you feel the same because we've had these kinds of discussions. So I'll allow others to talk about it.
Just speaking briefly about the things that Homeport is doing, we're definitely building communities or properties in these communities, and we try our best to respect the community that's already there, even with our infill properties. But we work with partners that, let's say if one of our partners is building a new development, we're in that deal to ensure that it's not just a market rent area where you have, say, a $1,500, $1,600, $1,700 unit, but that that community or that development is also holding a certain percentage of those units as affordable housing units so that the residents of that particular neighborhood still have somewhere to go, that they're not going to end up paying the 50% of their income, to meet the rent, that unit stays in that community and available to the residents there or other residents that want to move there.
I know Bea was here. I wanted to add one more thing to mine about having that partnership with banks and community organizations. I know she probably would want to reiterate that and bringing them together to work on some of the homes who may be in despair, giving some type of financial assistance to those homeowners to help bring them up. So that their property is just as nice as the ones that they're building, to Netta's point. So I forgot to mention that, but I wanted to make sure that that was something that could be a possibility when we're talking about private-public partnerships. Sorry, Dr. Joseph.
Well, it's okay. I was going to mention 4 things, so now I'm going to mention 3. Because I 100% agree with what you said there, Niall, that, there's great opportunity for community benefit dollars, community investment dollars. We kind of talked earlier about banks and the importance of banks. I think that's one of the opportunities. I think another opportunity for banks, as we talked about in those slides and in some of the MORPC materials, when you look at various income levels, we've seen over and over that Blacks are less likely to get a loan, right? Got to fix that. Right? Easy, low hanging fruit. You have to do the data analysis and fix that. Another area that I think is really critical is I was reading a story about tax assessments. In many of the Black and brown neighborhoods throughout Columbus are assessed at a higher value, about 50% higher in many areas. And then when it's time to sell, they're assessed lower. Right. So you're paying more taxes into the system, and then your home is assessed lower when it's time to sell. That's a huge issue. We got to fix it. And then I'd love to point out that, in some of our place-based efforts here at Ohio State, including the Partners Achieving Community Transformation led by Autumn Glover on the Near East Side, we do grants for homeowners so that they can actually fix up their homes, and we feel like that's critically important to being able to stay within the neighborhood. And then, on the Franklin Park, Housing Commission area, we've had a lot of conversations about when we're starting to fix up areas around town, there's often tax abatements. Well, what about tax abatements for people who've been living there for 20 or 25 or 30 or 35 or 40 years? Could you do the same thing, but to help those individuals who have been in the community for so long, who understand, to Niall's point, the culture of that community? Are some of those different opportunities? I know I'm supposed to talk about medicine and health and all that stuff, but I have some opinions about housing too. Thank you, Michael.
We like those opinions. So let's do shift in the time we have left. I do want to shift our direction here a little bit. COVID-19, racial equity, social justice. In 2020, our country had to face some really harsh realities. And what we know about COVID-19 is it exposed massive socioeconomic divide in our country. George Floyd's murder was a flashpoint for decades and centuries of mistreatment of Black and brown people. Acknowledging the role of structural racism in creating the circumstances we have today, how have the events of the past 16 months highlighted the issue of place-based outcomes? Let me stick with you, Dr. Joseph, right? We've heard stories of people putting off necessary health screenings and treatments over the past year because of the pandemic. Is that more pronounced among different populations? And have you experienced this among your own patient population? And what have been some of the ramifications of delayed medical care because of concerns around the pandemic?
So it's a great question, Michael. And, I'll talk about it in a couple different ways. I'll answer your first question actually last. But as part of I'm a member of the American Heart Association and serve in a lot of national roles there. And we had a campaign initially called Don't Die of Doubt, because what we saw was people were having chest pain at home and were not coming into the hospital to be treated for a heart attack. Right. And we're actually dying at home. And we saw that disproportionately in Black and brown and low socioeconomic status communities. The second piece of that was as the pandemic went on and people were masking up and using sanitizer and rates of COVID-19 were coming down, we were saying, look, first we said we want to do telehealth visits with folks. And telehealth visits exposed a whole nother layer of issues around the digital divide and how we're able to provide care. And there's many place-based components to that. You know, I drive from the north side to the east side, and even on my Verizon, iPhone right here, the speed that I get is much different. Right? Same Verizon network, same phone. And so it was difficult connecting with certain populations through telehealth. And then, we said, well, look, it's time to get back to your doctor. We did a national campaign, get back to your doctor, get in, get those screenings done. And that was very difficult for people to want to re-engage with the health system, particularly among communities that already have high levels of medical mistrust at baseline. And so major issues that we're facing in my own practice, I will say that individuals had, much less control of their diabetes throughout the pandemic. Part of that was the stress of the pandemic. I mentioned cortisol earlier. It drives higher blood sugars. And Lord knows we were all stressed during the COVID-19 pandemic. The last thing I'll say is that there's a very nice article by Andrew Stokes. He's up at Boston University. I actually went to medical school there. And he looked at factors related to excess deaths not assigned to COVID in the United States. And Michael, you could pretty much take your presentation from the beginning slides, and it is that group. It is individuals with high income inequality, high population density, high percent non-Hispanic Black, low percent home ownership in Midwestern and Southern states. That's where we're seeing the highest rates of excess deaths, really indicating a pattern related to structural racism and socioeconomic disadvantage.
Yeah. And for you, Netta, right, the housing market has gotten even crazier over the last year. Home values have jumped, rents have gone up. How has that impacted Homeport clients? And are you doing more or less down payment assistance? Is Homeport getting into the foreclosure business at all with folks? Is that an issue?
Yes. So to both of those questions, first, I'll talk about foreclosure. Homeport does offer foreclosure prevention counseling. We offer clients counseling. We're still respecting COVID and the COVID restrictions. So we are offering counseling either by phone or by Zoom if the client has the capability for it. But we are allowing clients to sometimes pick up information, or we will mail information to them. We'll email it, however we can get it over to them. We will assist them with completing workout packages with their lenders to make sure that the requests are being honored and responded to in a timely manner. So the counselors will speak with lenders alongside of the client to make sure that we are asking for those things that clients actually need, that they may jump at, let's say, the very first thing that's thrown out there, and that may not be the most affordable option for them. We are there to make sure that the client understands what the options are and what the lender is offering.
Right.
The down payment assistance, because most of our clients that would be eligible for down payment assistance are probably the hardest hit by COVID. We did not see a whole lot of applications during 2020, but we are definitely starting to see those applications come in now, especially since the dollar amount of the assistance has been raised. We try to be accessible to clients for counseling, education, however we can make that happen. Again, they can access our education classes either on their tablets or cell phones or on their computers. They can submit information by mail or drop off or send it by fax. We're doing everything we can to meet the client wherever they happen to be at this moment with whatever type of assistance it is that we are able to give them. And we offer a long-term approach. If you come to us and you're ready to purchase, you don't have credit or savings issues, we can help get you to the finish line in as little as 3 to 6 months. If you are one of those clients that literally you just woke up this morning and decided, I think I want to buy a house, but you have no other information about what the process is like or what it's going to require, what kind of savings or job time is going to be required, we're there for you with that as well. As long as the client stays engaged in the process, our housing advisors will stay engaged with them to get them to what that goal or that dream needs to be.
Okay. And from a public policy perspective at MORPC, we, both the city and the county, have declared racism a public health issue, but do you think that the Central Ohio region has been responding to the issues of the last year, and are we rising to the occasion?
I think there's good momentum. It's slow. I think, as you know, we didn't expect to complete the regional housing strategy during the pandemic. And I think the issues that, it was timely, but the issues that came up were in terms of disparities, like eviction rates, people not being able to buy houses in underserved communities. I think those issues were exacerbated by COVID-19. And so it was a good time for us to renew our focus on equity and racial injustice. And so I think having that information, in particular with the regional housing strategy, with our dashboard, we're tracking that information. We're tracking the key matrix to our housing supply, affordability, equity. Not only are we doing that, we're tracking mortgage rate denials. So as you know, a lot of decisions are made by data. And so if we have that information, I think that is a good case for making any policy or legislative changes. So I'm glad that we were being proactive, we were ahead of it. It's just the timing worked out that this, like in talking with our peers and other regional councils, other MPOs, housing has been the number one probably issue that they've had to address in their communities. So I think having access to this information, being able to track it, benchmark it, and present this information is a strong case to move the needle and a strong case to make sure that we're ensuring equity across our region. So some things are happening. I know Reynoldsburg has made some changes. I know City of Columbus. So yes, there we've seen some positive momentum. It's just going to take a while to undo decades of this type of intentional, I would say, disparity. So we're hopeful. We're going to be hopeful, and we're going to continue to do our part to continue this conversation. So I think that's why today forums like this are very important, and to continuing to get the story, get the messaging out so that people know that this is being addressed. So
in that spirit, it will take time, but the more we wait, the more people who are hurt by the residual impacts of these policies. What is one call to action that each of you might propose that folks in the audience could do at a personal or professional level to help advance any of these issues? If there's one quick word of advice, right? What would that look like for any of you? And doesn't it matter what order? I'd like to hear one idea of a call to action from each of three of you.
I would encourage our local communities to look at our implementers toolkit for the regional housing strategy. They have the ability to make changes within our ordinances in their communities, continue with public-private partnerships. When these businesses come in, trying to get the money up front to make the improvements, to make the investment in the community.
I would say just be a supporter and proponent of affordable housing. As you see these things trying to come to your neighborhood, we often run into cases where, yeah, affordable housing is great, but I don't want it in my neighborhood. We need more neighborhoods to be supportive of that concept and to be more welcoming to organizations like Homeport and others coming there and developing new deals.
For healthcare organizations, I think one of the great opportunities is to think outside of the four walls of the healthcare building. right? We all have buildings, we have hospitals, we have outpatient clinics. But how do we get outside of those four walls to address social needs, whether that's through referral-based systems or other components within our system to screen and address these social needs? The other thing I would say is that, here at Ohio State, as an example, we're trying to build a healthy community campus on the Near East Side where we have a hospital, we have an outpatient clinic, but we also have a African American Studies Extension Center on the Near East Side. We also have a Columbus Recreation and Parks Department where we're partnering, as well as the YMCA, the Ward YMCA, where we're partnering on a program called Exercise is Medicine, where people can get out into the community and exercise in their own communities. We're supporting 5 community gardens on the Near East Side through the Growing and Growth Collective and PACT. And so how can we create these healthy environments in our own communities? And the centerpiece of this will be in 2023, a Healthy Community Center at the site of the former MLK Library, where people can come in and it will be their space to get healthy, right? Not focusing on sickness and illness, but focusing on health.
Well, I am honored and humbled to have spent this last 90 minutes with the three of you. So thank you to Brandy Avery, founder and CEO of Keys to Black Wealth, who had to drop off for a national conference that she is with. Thank you to Netta Whitman, who is Director of Housing Advisory Services at Homeport. And to you, Dr. Joshua Joseph, Assistant Professor of Medicine at The Ohio State University Wexner Medical Center. And of course, my friend Neil Juris, Director of Communications and Engagement at MORPC. Columbus is a growing city, and that gives us incredible opportunity. It also gives us challenges. I am glad that we have the challenges that we have, as opposed to the community that I grew up in Youngstown, or other nearby legacy cities who really have struggled to get the growth that Columbus has. I am convinced if we take the predictable growth that we have had decade after decade, and we look at the growth that is coming to our community and focus it in the right ways, we can be a more prosperous region for all. Before we close, we hope that you will join the MORPC team for the next Housing Speaker Series event, which is on August 20th, called A Return to the 15-Minute City, community design that put residents closer to the services and amenities they need, thanks to sidewalks, bike paths, and enhanced public transportation. The panel will discuss how a 15-minute city works, what it would look like in Central Ohio, and it could make our communities more equitable. Because yes, sidewalks are a social justice issue. So I want to just thank all of you, again, the panel, for participating with us today. Your commitment to the work around social justice and equity is admirable, and we need more people like you in this community. And thank you all for spending the last 90 minutes. We hope you've learned a lot more about Columbus and have charted a future path of success. Thanks so much, and have a great day. Bye-bye.